set, go.
Good afternoon. I'm Mary Miller, our nurse manager here at Community Hospital. Today I will be speaking with Kate, a certified nursing assistant trained in the ambulation of patients with mild to severe mobility limitations. Our short interview will focus on the patient with moderate abilities of ambulation. This video will be utilized as a training video for staff in the ambulation of patients. Kate, it's a pleasure to meet you, and thank you for joining me.
Thank you for having me.
Can you please explain what you would do prior to ambulating your patient?
Prior to ambulating the patient, I would report to the nurse. Then she would assign me the patient and then also give me the patient care plan. The patient care plan has any information about the patient, and it also includes needs of the patient or if they have any limitations. That's important to note today since we're going to be ambulating them. If the patient has an affected or weakened side, it's important because during ambulation that might affect it.
I see. Any additional information you might ask the nurse at that time?
You would also ask the nurse the last time the patient was ambulated and if they've received any medication or pain medication.
Why would you want to know that?
You'd want to know that because it would help in understanding the tolerance of the patient for when they're ambulating.
I see. And once you've gathered that information, what would your next steps be?
I'd continue with my initial steps of meeting the patient, greeting them, and telling them who I am, and then informing them of the ambulation that they're going to do today.
I see. And once you've done that?
Once you've done that, if the patient's in a lying position, you would sit them up in bed and put them into a dangling position. This is when the patient's at the edge of the bed and their feet are dangling over. It allows for the CNA to look for any signs of dizziness, weakness, or discomfort in the patient.
And if they exhibited those signs, what would you do then?
If they exhibited those signs, I would immediately lay them back down into bed, pressing the call light to wait for the nurse to come into the room. While waiting, I would monitor signs of respiration and pulse, and then I'd also watch for the patient's pain levels and see if they're still dizzy or discomforted.
Okay. Now, if you did dangle the patient and had no issues with any of those things, what would you do then?
If there are no issues in the dangling, then the patient would be ready to ambulate. The first step I would do is to place on non-skid shoes. This prevents patients from slipping or falling and allows for their safety. And then the second step would be to put on a gait belt to help with ambulation.
And can you explain what a gait belt is?
A gait belt I have here is
good.
a tool that we use, both nurses and CNAs in hospitals or nursing homes, and it's an ambulatory device that allows the nurse to have a good handhold on the patient while ambulating. You place this around the midsection of the patient, over the clothing, so it prevents skin chafing. And a good rule of thumb for comfort of the gait belt is if you're able to insert your hand between the patient and the gait belt, that's enough distance away to give comfort to the patient but still be effective in the use of the gait belt.
I see. That's a great tip. Thank you for that. Now, once you've applied that gait belt to the sitting patient, what would you do then?
You would move to the affected side of the patient if they have one, and then you'd place your hands on the side of the patient and then underneath the gait belt on the back for base of support.
Okay. Now, you said you would place your hands on the side and the back. Is there a particular position you should have your hands in when doing that? Can you explain?
It's really based off of personal preference. I feel like if you have your hand underneath in the back, it's more support. And then on the side, it's really, if you decide you want it on the top or the bottom, it's just personal preference.
So just as long as you have a good grasp, whether it be underneath or on top of the gait belt for
Correct.
support. Okay. And once you've done that, what would you do next with your patient?
You'd inform the patient that you're going to begin the process of standing. You communicate with the patient that on the count of 3 that they are to stand and that you'll be aiding them, and then using proper body mechanics you get the patient standing.
Okay, very good. And once the patient's in a standing position?
Once the patient's in a standing position, you'd again check for signs of dizziness, discomfort, or weakness. Making sure, because if those occur, you still can't do ambulation.
Okay. And if you had none of those symptoms or complaints?
If you had none of those symptoms or complaints, you would begin ambulation. You'd inform the patient that they are to take their first step with their affected foot and then followed by their unaffected foot.
Okay. And why would you want them to lead off with their affected or weaker limb?
You'd want them to lead off because you're a base of support from them on the side, and then their strong leg is also supporting them so that the affected limb can take their first steps.
Okay, and once they take that initial step, you would then do what?
You would follow behind the patient on the affected side, slightly to the side and behind the patient, making sure you're still having a firm grasp on the base of the gait belt from behind.
Okay, and once you begin ambulation, you would walk the patient in a hallway?
Correct. You'd typically walk them in a hallway that doesn't have a lot of clutter, not a lot of things cluttering the hallway, and then also chairs are scattered throughout the hallway if the patient does become fatigued.
I see. And if they should become fatigued, what would you do with them?
You would assist them into the sitting position until they're rested.
Okay. And once your ambulation is complete, what would you do next?
You'd bring them back into their room, assisting them into the bed in a sitting position. Then you remove their non-skid shoes and the gait belt,
Okay.
and then assist them back into the bed in a lying position that they're comfortable in, making sure there's proper body alignment. And then you would lower the bed to the lowest setting, apply the guardrails if required by the patient care plan.
Okay.
You'd administer the call light, making sure it's within the reach of the patient and they know the position of it. And then you'd also make sure that there's water within reach of the patient. After all of that's done, you'd ask the patient if there's any pain or discomfort from ambulation. You'd also ask them if they need any additional requirements from you, help opening windows or maybe positioning them in a different position in bed. Once that's done, you then thank them for their service, and then once you've left the patient's room, you document what's occurred for the day. Today would be ambulation, and then you'd also report, this is very important, you'd report to the nurse if there's any discomfort or pain exhibited during ambulation or after.
Okay. So if we were to ambulate a patient with moderate mobility limitations, some of the primary things to remember are always to initially understand your patient's abilities and weaknesses, to utilize a gait belt as a safety aid device when ambulating, 3, continually monitor the patient throughout ambulation for safety and changes in condition, 4, once ambulation is initiated, lead off with the affected leg first as a base of support, supporting on the affected side with the gait belt. 3, and finally, return the patient to the room in a safe position, making sure they have a call light and all their needs are met. And finally, you would document in the patient's chart the ambulation process and inform the nurse of any changes in condition or complaints or how well the patient did. Is that correct?
That's correct.
Okay. Well, thank you very much, Kate. I appreciate your time today, and it was a pleasure working with you. Thank you.
You did.